have a standard medical nomenclature that you use. So for instance, like BAR stands for bright, alert, and responsive. QAR, quiet, alert, and responsive. But just because you have those initials doesn't mean people know what they mean. So you need to have almost like a key code so people understand. You need to have a way to report drug reactions or vaccine reactions or any other kind of reaction to any treatment that's performed. Your facility, kind of going with contagious diseases, you need to make sure that it's sanitary, that there is general maintenance, that there is a housekeeping plan. As silly as it sounds, once we established a who cleans what and when, hospital looks much better, smells much better, and we're more productive. If you have junk everywhere and, 50 years worth of medical supplies that you haven't used in 40 years, that's not efficient. That slows you down. And just hoarding as a general rule is something that most veterinarians do. We might use it in 30 years, so we should keep it. You don't need it. Clean it up. Streamline it. You need only the equipment that you need, only the supplies that you need. You don't need a lot of clutter. In my exam rooms at Independent Hill, we have cabinets that are on the wall above and below the counter. And I actually took the cabinet doors off, the ones that are above, because you can't clutter if it's just shelves, right? Because you don't want it to be cluttered if clients can see it. But if there's cabinets on there, my staff is going to stick stuff in there. There's going to be like 50 rolls of paper towels and 500 pamphlets, and we don't need it. If you're not going to use it, you don't need it. Diagnostic imaging is another category. We use digital radiography. We actually use CR and not true DR. CR means that it's digital, but there's still these cassettes that a computer has to read. DR is you take the image, bam, it's on the computer, and you don't need the cassette. You need to have certain protocols in line for radiation safety, radiation badges that are inspected routinely. You need to have your machine inspected to make sure there's no scatter radiation. When you're taking an x-ray, the main focus of those x-ray beams is on where your light is, but if your machine's not up to date, you may have more x-rays that kind of disperse outward. Every film that you take has a certain amount of scatter radiation, and you want to minimize that as much as possible by what's called collimating. So you make the light that you illuminate on the leg, so the amount of radiation that animal is going to get exposed to is smaller. It's better for the patient, better for the people taking the x-rays. You also want to make sure that your equipment is up to date, and that's not just your x-ray processor. You want to make sure that you are checking your gowns. So when we take x-rays in veterinary medicine, we don't normally have our patients sedated unless they're orthopedic x-rays, because in those cases you need very specific views and you don't want them fighting, especially if they're painful. But they don't have to be sedated. In the state of New York, they have to be sedated for every x-ray. So we have at least 2 people in the room helping to hold the animal, because you can't say lay down and then they'll just lay down. So you have to gently lay them down. You have to position them the way that you want. So you want those people to be protected. So they need a full lead apron. They need leg gloves. They need a thyroid shield. They need a x-ray badge. All of those are necessary to keep them safe, but if that gown has a bunch of holes in it, that's not going to do anybody any good. So you have to periodically actually x-ray your equipment to make sure that it's still effective. Laboratory, you want to make sure that you have quality control. Both hospitals have in-house lab equipment, so we can run blood work in-house, but we need to make sure that that blood work's accurate. We also need to make sure that we have adequate equipment and supplies, a microscope, the ability to check urine, the ability to stain slides and look at those under the microscope. Pharmacy, that's a big one, right? So controlled substances, those have to be logged very specifically. Who used it? When did they use it? Why did they use it? How much did they get? And who prescribed it? And all of that has to be kept in these logs. We have to keep all the receipts in a very specific order. And part of that is like the state of Virginia tells us we have to do it. But the other part of it is AAHA. They want to make sure that everything is accounted for and that there's no drugs that could potentially have gone missing, because if you're not monitoring for it, you're not going to know that it's not there. How do you dispose of drugs? How do you dispose of non-controlled substances versus controlled substances? What happens if an animal has an adverse reaction to a medication? So having that logged is generally helpful. Surgery. So we want to make sure that the patient and the area where the surgery is going to occur is consistently cleaned and free of extraneous supplies. You also want to make sure that that surgery suite is not something that people walk in and out of every day. You want to make sure you have specific surgical attire. Same thing with dentistry. So When we're doing dentals, they have to wear protective eye equipment, they have to wear gloves, they have to wear a face mask, ideally a bouffant or a covering for the head. A bouffant is like, looks like almost like a hairnet. It's like this fluffy blue kind of sheer cloth that has elastic around it that then you put on your head to keep your hair back. It keeps your hair out of things, but also keeps your hair clean. You have to wear specific smocks over top of your gown because when you're doing a dental, there's bacteria and grime and gross that gets sprayed, and you don't want to keep that on your clothes that you then walk into an exam room and touch a puppy or touch a sick pet. You need to make sure that your surgical instruments are properly cleaned and sterilized. You need to make sure that your packs are packed appropriately and labeled and re-autoclaved as needed. You need to make sure that your instruments are safe. You need to make sure, like we talked about, that your surgical suite is clean, pristine, and streamlined. You don't want a bunch of stuff that people are going to need to walk in and out to get to use in other situations. Client service, that is another big one. We want to make sure that we have adequate client communication, not just that it's documented, because having documented client communication helps clear up confusion between staff members, between the veterinarian and the client. Patient care is another hot button issue. You know, we talked about wellness protocols and in pretty good depth in the vaccine portion, but kind of going along with the vaccines. You know, when do you do exams once a year? When do you do them twice a year? How often do you recommend fecal evaluations? How often do you recommend blood work? What blood work do you use, which is dependent usually on the age? When do you run your analyses? When do you do other testing like blood pressures, eye pressures? When do you recommend referral to an outside facility? So referral is another section. So there's tons of categories that we have to look at, and it really helps you kind of focus on areas where you may not even realize you were deficient because you didn't think about it. And so having it all in one place is great because it lets you realize where you need to improve and how you can improve, because just knowing that you're deficient isn't enough. You need to know how you can fix it. And at least this year, AAHA wants those protocols, so they need to be in practice, right? So it's not enough just to have it written down. It actually has to be done, performed by your staff members. But the protocols in the past were in binders, and it was always like 500 binders, and you'd have to look for them. But now it's okay to have them on the computer, and for people that are OCD or CDO, if you want to do it in the right order, and really like to do like the nitty gritty, you can be super geeky about it, and you can have, you know, a Word document for every protocol, a folder for every protocol, and then within that Word document, you can have hyperlinks to articles that help improve knowledge base for that particular topic. So it lets you get really nerdy and really organized, but I kind of like that part. And going through the accreditation process, like having to do it at Montclair, basically from the ground up, is actually very helpful for Independent Hill because it forces me to take a step back because I can't help but compare both clinics as I'm doing it. And it lets me say, oh, I didn't realize that we were deficient in that area. Other categories to think about: continuing education. Every employee has to have a certain number of continuing education hours. So veterinarians, by different state laws, are required to have a certain number of education hours. For AAHA, it's at least 20 hours. Your practice manager needs to have about 20 hours. Your vet assistants need to have 15 hours every 2 years. And your licensed technicians, I believe, need to have 10 hours every year. And that just helps to ensure that everyone is up to date and everyone is learning all the time. You need to make sure that you have specific protocols for your human resources department. You need to make sure that your leadership is aware of its job, aware of how to perform it, and is actually improving the culture of your practice. And AAHA this year had its first ever conference, basically all about culture, and that was Connexity, and that was really cool. And hopefully a different podcast, I'd like to interview some people from AAHA to get, you know, more from their point of view, just the importance of this. And I get really excited, but sometimes I don't know that I explain it very well. But I'd also like to talk to the people involved with Connexity, because that was hands down one of the best conferences I've been to. And I, to be honest, would never have volunteered to go. You know, I was elected / voluntold by Petwell to go, and I am so glad that I did. It was definitely one of those examples of you were meant to be at that place at that time. And it just was this whole branch of veterinary medicine that I didn't think about because it wasn't medically related. It was related to my interactions with my staff, my interactions with fellow Petwell people, my interactions with my clients, and my personal self-help and self-care. Because if I don't take care of myself, I can't take care of your pets. And it was awesome. It was super amazing. And I'm really glad that I went. And I really look forward to next year. Hopefully I'll get to go. But I think that is so crucial. And the fact that AAHA is branching out into that is awesome because they can take all of their knowledge base from the medical side and expand it and say, okay, we're taking care of our patients. We need to take care of our culture. We need to take care of our hospitals so we can better help our patients, so we can be more efficient, so we have a positive work environment, because you're more productive if you like where you work. And it was just, again, I'd like to talk about it in more detail in another podcast, but it was pretty cool. So the last thing is safety, one of the last standards. And having like a general safety plan, or like even a fire safety plan, having like a floor plan so people know how to get out, seems obvious, but it's not necessarily obvious. So having like okay, this is where we would all meet. Because when I was developing it for Montclair, I said, all right, well, in my mind, it makes the most sense to meet here. And they said, well, no, that doesn't work. Because I was thinking like the front of the hospital, but the front of the hospital is basically like a parking lot that is then next to a busy road. So if, your building's burning down, you don't really want to be trapped between like a burning building and cars going 50 miles an hour. So then we changed it to go out the back portion in like a grassy knoll area away from cars and oncoming traffic. But just having that conversation with your staff, getting them involved, and doing this whole process is not just me dictating, okay, so it is said, so it shall be done. This is how we're going to do it. It's getting involved with the staff and saying, all right, especially because, again, I'm transient, right? I've come in, the staff has been there a while. How do you guys do it now? How can we improve it? What do you think we could do to bring up the level of care? And getting your staff engaged is really important, because if they're engaged, if they feel like they're contributing, they're going to have more buy-in. If they have more buy-in, they're going to be more likely to follow the protocols, which will, again, help patient care, help your hospital, further treat your patients, improve your quality of medicine, which again is the whole goal. So I created this kind of like comparison chart for something like an anesthesia protocol between an AAHA certified or accredited and a non-AAHA accredited. And obviously you can't see it because, again, this is audio, not visual. But there's really not that many things that you would tick off if you were a non-AAHA accredited hospital, right? You may or may not do an exam. You may or may not have standardized sedation. Like you may not tailor it to the patient, and maybe every animal gets this drug regardless of if they're sick, regardless of their age. You may or may not do an IV catheter and IV fluids. And it's really important when you're under anesthesia, especially for a prolonged period of time, to make sure your blood pressure is good and your blood perfusion to your vital organs is good. And then what you do that is through IV fluids. And if there's an emergency, you really want to have access to a vein. And the fastest way to have access to a vein is with an IV catheter. And a lot of hospitals don't necessarily have one person dedicated to monitoring the anesthesia. Sometimes it's the veterinarian's doing the surgery and then periodically looks up at like, they may have an ECG and that's it, to make sure that the patient's doing okay. And then there's an assistant outside of the surgery suite that may or may not be paying attention. And then post-op pain management is a big thing. A lot of clinics don't necessarily require post-op pain meds. Some, it's optional. Like you can opt not to do it because it costs money. But having post-op pain control is very important, because it improves your patient's recovery. It improves your patient's well-being. It helps the owners, because if their pet looks painful, and then they're stressed, and their stress level is going to contribute to the patient's stress level. So it just kind of snowballs. All right, so I talked for like 30 minutes, right? So what does all this mean? It means better medical care for your furry family members, state-of-the-art medical practices, tailored vaccination protocols, safer anesthesia, more